As a brief description of what our program is, the Levine Children's Hospital Pediatric Heart Transplant Program is the only heart transplant program in the region. We're the only nationally ranked pediatric cardiology program in the Charlotte region, and we're quite proud of it. We have had tremendous growth over the past year. We have been lucky to be able to open a new clinic with the Hardest Yard Congenital Heart Center. This opened in December of 2020. And this allows us to provide comprehensive care for our children with congenital heart disease. And what we mean by comprehensive is from fetal life all the way up to adulthood. We make the diagnosis when they're babies in the womb, and we prepare for them if they need surgery immediately after birth, and then we care for them in a brand new clinic, which was a very generous donation from Greg and Kara Olson. We're lucky enough to be able to have all the pieces necessary to provide good care to these patients. We have imaging and diagnostics. We take care of the patients on the outpatient and the inpatient setting. If they need surgery, they are cared for by our surgeons and our intensive care physicians. Our pediatric intensive care unit provides world-class care for them, which allows us to do more and more complex surgeries. And should there be any complication or need for any extra procedures, we care for them in the pediatric catheterization laboratory. We can deal with their arrhythmias with electrophysiology. And once everything goes well, we're lucky enough to care for them again in clinic all the way through adulthood with our adult congenital clinic. Not only we take care of the physical, but also we focus on the patient as a whole. And we're also very proud to be the first of its kind in the region with our neurodevelopmental clinic, where we focus on the children development and their other needs, not only physical, but also mental and psychological. And so we're quite proud of how far we have come here in Charlotte and at Levine Children's Hospital.
Thank you, Dr. Wallace. And also want to boast around your team a little bit. You all have just had a very busy week with 3 transplants in 2 days and another one this week. Can you share a little bit about the transplant program success just this year alone? You've recently reached a milestone of 100 pediatric heart transplants to date and are well above that since reaching that milestone in early 2021. Can you share why this is important for our community to know and what sets us apart?
I think that it's important for the community to know that they don't have to go anywhere to get extraordinary medical care. And by extraordinary I don't mean necessarily that we're above everybody else or anything like that. What I mean is, in the past, people who needed a heart transplant needed to go to places like Boston and Philadelphia and outside of the region, and that was something quite disruptive and oftentimes led for separation of families, led for prolonged stays in different cities, and most importantly, disruption of normal family dynamics and normal life. We're lucky enough that we have been able to build a multidisciplinary team here in your own city and do the most complex cardiac surgeries. And when unfortunately hearts don't work or they can't work anymore, we're able to do extraordinary things for them and then give them a second chance of life. What better thing to do than be able to do that for a child?
Thank you, Dr. Wallace. as a pediatric cardiologist, can you share with our audience what that follow-up care process looks like, maybe what that cadence looks like for a child who undergoes a heart transplant once they do end up leaving the hospital?
Sure. We're pretty lucky in our specialty because we get to evaluate the patients before they need a transplant. So we build bonds with them and their family, and then subsequently we take care of them in the hospital. And as they leave the hospital for a successful transplant, we follow them initially quite often. We probably for the first year we see them almost monthly, as we're going down on some of the medications to make sure that the heart is not rejected or does not work well. After the office in the first months, we see them weekly for about a couple of months, and then monthly until they're about a year away from transplant. And then afterwards, we see them every 3 months. On average, pediatric hearts tend to last for a very long time, and the survival of a heart transplant keeps getting better and better. So as you can see, it's a long relationship that we have with the families over a prolonged period of time.
Absolutely. That relationship building is very critical, as I know that you work with these families for a number of years, both before transplant and after transplant. Thank you so much, Dr. Wallace. Is there anything else that you'd like to add that maybe we didn't get the chance to touch on before we introduce Katie?
I would just advocate for people to become organ donors. That's the most important thing.
It is very important. Thank you so much, Dr. Wallace, and we'll touch on organ donation shortly as well. Now I would like to introduce Katie Robinson. She is our pediatric cardiac transplant coordinator and also plays an integral role in the heart transplant process. Katie, first, can you please walk us through your credentials, specifically the CCTC and CPTC? And you were also president-elect of our national certifying board, the American Board for Transplant Certification. And can you also share just a little bit about why that brings a unique perspective to our transplant process?
Hi, Savannah. Thank you guys for having us have the opportunity to talk to everyone today about what we love to do on a daily basis. But yes, as long as I've been a nurse, I have had care of the transplant and donors, whether it was first as a critical care nurse in the ICU, then as an organ procurement coordinator, where I was directly facing direct face care with both organ donors and their families, and then now in my current role as the pediatric cardiac transplant coordinator. So when I do things, I like to do them well, and I like people to be able to know that I am a resource. And so I obtained clinical certification as both a procurement and a transplant clinician. And I think that having been able to have that full circle perspective, now working with the transplant recipients, is both invaluable and unique, and also allows me to have an ongoing respect for the transplant process.
Excellent. Thank you so much, Katie. And then can you also share a little bit about, give us some insight, once it's determined that a patient is in need of a heart transplant, what are those next steps? And how is that transplant waiting list structured?
So once it's been identified that traditional medical therapy is just not cutting the mustard, then a formal evaluation for transplant is initiated. And this is done either on the inpatient setting or outpatient setting, but in both settings, what we need to review is the same, but it would include educating the family on the transplant process, because unless and until you need that, you don't typically understand all that is involved. So short and long-term considerations to transplant, ensuring other organs are healthy enough to undergo the transplant surgery and support the new heart. And that looks like blood tests and x-rays and ultrasounds and such things like that. And also asking other subspecialties to evaluate the patient. We obviously know that the heart is sick. We want to make sure that the other organs are healthy. So GI physicians making sure that the liver is healthy, pulmonologists that the lung is healthy, infectious disease experts letting us know that patients are free from infection and up to date on vaccines. And then also, because it takes a village and no one can go through transplant alone, we need to make sure that these transplant patients have good family support, and that they're also strong and healthy from a nutritional standpoint to go through surgery.
Excellent. Wow, certainly a lot of levels that need to go through in order for a patient to then ultimately receive a heart transplant. And then what happens when a heart really becomes available? Can you also share with us what it's like being the one to tell families the news that they have a heart on the way?
Well, it goes without saying that, but certainly should not go without mention that all of this is not possible with the altruistic gift of life from the donor family or the donor. But that being said, the process, it isn't official until we get an offer from the United Network for Organ Sharing that there has been a match identified for our particular recipient. So as I outlined earlier, how we get the patient evaluated, once the evaluation is complete, then they're actually placed on a national waiting list with the United Network for Organ Sharing, and there's a process by which those matches are made. But once the organ offer is identified as a potential match for our recipient, then the transplant team reviews the offer, the cardiologist and the surgeon. And if we deem it's medically suitable for our recipient, then the next conversation is with our patient's family to make sure that they're aware that we've identified we have a good heart for their child. Then it's usually a long day with lots of moving parts and lots of individuals who need to be involved in the process. But within the hospital, lots of departments need to be aware and ready for the transplant. So the operating room, the blood bank, also our medical center air team for transportation logistics, lots of conversations with the organ procurement organization who's actually managing the donor and is oftentimes facilitating transplants for other organ recipients besides the heart that we are being offered, because an organ donor can potentially save the lives of up to 8 different individuals. So that's a lot of moving pieces.
Absolutely. And with all of those moving pieces, what's that timeline look like? Does this happen within a matter of hours, a matter of days? Does it take up to a week? What does that look like?
So it can vary from situation to situation. There are times when we are notified that we have a potential offer and it doesn't become primarily ours for 24 hours. And then we go to the OR in the 6th. And there are times when we're notified and we're ready to go, but it might be 24 hours from that point in time for various reasons, whether there's flight delays because of weather or other things happening. But it's definitely a situation that is fluid and not the same any time.
Well, thank you so much, Katie, for all of that insight. Certainly a lot of moving parts to be mindful of. Next, we will turn it over to Dr. Jennifer Bailey. She is one of our pediatric cardiac intensive care physicians and also plays an instrumental role in this process. Dr. Bailey, thanks so much for joining us. Can you share a little bit about your role as a pediatric cardiologist in the cardiovascular ICU?
Sure. Thanks so much, Savannah. So as pediatric cardiologists, we have extensive training in taking care of children with congenital heart disease as well as acquired heart disease. But then as an intensivist, I've also done extra training to take care of specific patients that have critically ill conditions as it relates to their heart. They oftentimes need life-saving medications that we can only offer in the ICU. Sometimes they need high respiratory support to support their lungs. Sometimes they need breathing tubes and ventilators to support their lungs that also then support their heart. So also the heart is very essential in keeping all of your other vital organs important, such as your kidneys and your liver and your stomach. And so oftentimes when kids have critically ill hearts, other organs are then going to suffer from that. And they also need medications and therapies and treatments that is offered in the ICU to help keep those organs alive, which is also important in keeping the heart functioning.
Excellent. And you touched on this a bit, but what does the role of the CVICU play in the heart transplant process? Does every patient who receives a heart transplant go to the CVICU? How long are they there for? What does that monitoring process look like as well?
So every patient that has a heart transplant, as well as many other heart surgeries that are offered to children, oftentimes are with us before and after their surgery. So immediately after transplant, they come to us from the operating room, and they have breathing tubes, and we are controlling their breathing. They're on medications, again, to help keep their heart healthy and alive, as well as many other medications that they need in order to keep them healthy and to keep their new transplanted heart healthy. And we work very closely with the surgeons, with the transplant team, with nurse coordinators, respiratory therapists. It really is a very comprehensive and large team that is necessary to work together and really do what's best for the patient in every scenario. But absolutely, every patient after transplant comes back to the cardiac ICU, and it's then a teamwork effort to keep the patients healthy and alive.
Thank you, Dr. Bailey. And of course, you see children when they're really sick, but of course, not all moments are bad or sad. So can you share with us, what is your favorite part of your job?
Absolutely. I mean, you definitely have very tough days and tough patients, patients that may not necessarily always make it or stay as healthy as you would like. But and majority of the patients, my absolute favorite part of my job is seeing patients leave our unit and eventually leave the hospital, as well as, like Dr. Wallace was saying, you know, these patients oftentimes are with us for weeks, sometimes months, and you really do form a bond with the patients and the family members, and to be a part of that and to watch them and support them get through this very stressful and difficult time is difficult, but very rewarding, because on the other end, you do get to see them go home and reunite with their siblings and their grandparents, and it just is a very joyous moment.
Absolutely. What a special moment. And I know that you and your team play such an integral role in this process. And next, I'd like to also introduce Cami Daigle. She is our CVICU nurse manager and also works closely with Dr. Bailey and the team. Cami, thanks so much for joining us. Can you share a little bit about your role as a CVICU nurse manager during the transplant process?
Yes, it's very exciting. I think that's kind of the first emotion that we all think of when we hear transplants coming. The next is kind of the collaboration between, and it's already been mentioned by everyone on this call, so you can see how important it is. But there's so many teams involved in this process and getting ready. On the nursing side, you know, a lot of our patients either are coming to us from the outpatient clinic that Dr. Wallace mentioned, or the inpatient progressive unit, and then that's where they go to after they leave our unit. So it's kind of not just my unit preparing for the transplant and kind of coordinating for that, but also multiple places and multiple teams that we work really closely. So the collaboration is huge. And I think it's really where Levine's as a whole, the teamwork just shines through, because everyone just gets ready for it. For my part, something that we're continuously working on all the time is just the education and making sure my staff is ready and prepared to make this transplant and any surgery or patient go smoothly. So we do a lot of education. We have a process that the nurses know what to expect, because these patients come back from the OR and they're very cute. And, you know, we want the nurses to kind of be the experts on how to care for them the best.
Absolutely. And I know Dr. Bailey touched on, and both of you have touched on really the role the CVICU plays. But can you explain to our audience, what's the difference between the cardiovascular ICU and how that may differ from the pediatric ICU or PICU or the NICU or neonatal ICU? We see there's a lot of different intensive care units. Can you share a little bit about how those differ from one another?
Yeah, so our cardiovascular ICU, of course, is most patients with either born with or develop some type of cardiac defect, whether it's cardiomyopathy or just congenital heart disease. And so every one of our patients, it's really a more surgically based unit than the other two ICUs that you see in pediatrics. So most of our patients are either waiting surgery or have freshly gotten surgery or need surgery. And so the NICU is primarily neonates or patients that are born prematurely or born with kind of other existing birth issues other than cardiac. And the PICU is really kind of a jack of all trades. They take everything, traumas, different. So three different types of ICUs, and our specialty is really to be the experts in the cardiac side.
Excellent. And then can you also share with us a little bit of insight as to how long our transplant patients generally stay in the CVICU and what factors may determine, their length of stay with us?
Yeah, so they come back from OR, and like Dr. Bailey said, they're intubated, they have a breathing tube, they have lots of medications that are going, so that's a very acute stage where we are really titrating and looking at them and taking care of them very closely. The thing I love about working with pediatrics is that they recover so quickly, and it's amazing to watch them go from that acute phase immediately post-operatively to walking in a few days, or blowing bubbles, walking down the hall, eating snacks. And so it really ranges depending on the child, but I'd say anywhere from a week to 2 weeks with us, depending on what's going on, how their body's kind of handling the changes. And then from us, they do go to the progressive unit, which they continue to get really great care and education. And so we partner really well with that unit as well to kind of give them a total care as they get ready to go home. And they can be on that unit again a longer time as well, just to prepare them and get them ready.
It's really amazing just to see how resilient our young patients are through this whole process. Thank you so much, Cami. And we'd also like to really conclude the panel discussion to take a moment to acknowledge and recognize our incredible donors and donor families, as truly none of this would be possible without the selfless donors and their families providing this. Cami, we'll start with you. Can you share a few words and maybe share why organ donation is so important? I know Dr. Wallace and the team have already touched on this, but would love to hear a little bit more about why it's so critical and encourage those who may be tuning in to consider organ donation if not already.
Yeah, so we do see these really exciting transplants when we are receiving them, but we are also on the donating side as well sometimes. And so every transplant is bittersweet because we know what has happened to make that happen. And we've seen the other side. And there's such honor in being a part of that end as well, because the patients and their families, just in their time of extreme grief, are able to think of other people and think of what their child could, give and donate, even despite the stage of, grief that they're going through. We started in our unit doing a hero walk, which when a patient is going to OR to donate, we line the halls, everybody on staff, we send it out to whoever can come really in Levine's. And I can tell you there's not a dry eye. It's so amazing. And the families have just been so affected by us giving that nod of gratitude. Because it really is a hero that can give to other people. And so being on both sides is one of the things that I think is so special about where we work. But it definitely brings just great strength to the whole program because we see it in whole.
Absolutely. Thank you so much, Cami. We have a couple of minutes left. Dr. Wallace, Dr. Bailey, Katie, do you have anything you'd like to add, maybe around organ donation or any final messages for those who may be tuning in?
I would just say that, it is very important for people to donate their organs or become an organ donor. It is the ultimate gift, is a way of saving multiple other people, and we unfortunately don't have enough. We want to be able to help more people and save more people, and it's the ultimate gift that they can do.
And I agree. I think just a special thank you to all the families out there that that have donated their child's organs or any family member's organs to save the life of someone else. It's very heroic and difficult, but a tremendous thank you to all those families.
Excellent. Well, thank you to each of you for your time and your expertise on this incredibly important topic, and really for bringing attention and recognition to our pediatric heart transplant process and the importance of organ donation. We know that congenital heart disease is the leading diagnosis for a child being referred for a transplant. Yet, as this group has touched on, we know donor hearts for any age group are of limited supply. So we're incredibly grateful to our donors and their families, and really to each of you and everyone on your teams for your work and dedication to giving kids a second chance at life. We recognize the unique challenges here at Levine Children that our patients face. And to everyone who's tuning in, please know that we are here for you and your families, and have many resources, programs, and expert clinical care to provide truly the best care for your child. Thank you, everyone, for tuning in, and have a wonderful day.